Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on 4 key papers for early intervention in asymptomatic severe aortic stenosis. 2 are published in the New England Journal of Medicine, 1 in JAMA and 1 in the European Heart Journal. Key findings in the EARLY TAVR trial, published in NEJM recently, 2025, in asymptomatic severe aortic stenosis, early TAVR reduced mortality, stroke, and cardiovascular hospitalization by 50% compared to clinical surveillance. There were no significant differences in procedural complications between early TAVR and later aortic valve replacement. In the AVATAR trial, published in the European Heart Journal in 2024, early surgical aortic valve replacement reduced all-cause mortality, myocardial infarction, stroke, and heart failure hospitalization compared to watchful waiting, p-value 0.002. It supports early intervention in asymptomatic aortic stenosis with normal LVEF. In the recovery trial, published in NEJM 2020, early surgical aortic valve replacement in very severe AS significantly reduced cardiovascular mortality compared to conservative care, p-value 0.003. There was lower sudden death incidence in the early surgery group. And in the EVOLVE trial, JAMA 2025, there was no significant difference in all-cause mortality or aortic stenosis-related hospitalization with early aortic valve replacement. However, early aortic valve replacement was associated with fewer hospitalizations and improved NYHA class. The conclusions in total were early aortic valve replacement generally provides better outcomes in asymptomatic severe AS, except in select subgroups. Future trials like EASY-AS will clarify optimal management strategies. The limitations and weaknesses of the 4 trials: in general, open label in 2 of them, which may introduce bias, small sample size, conducted in limited geographies, limiting generalizability, and follow-up duration may not capture late-stage outcomes. There was a recent opinion piece with Dr. Brian Lindman, Dr. Braunwald, and Dr. Patricia Pellica in February 2025 in JAMA Cardiology, where they said that they together believe that the time has come to recommend aortic valve replacement for asymptomatic patients with severe aortic stenosis, and this in part due to better perioperative mortality and in the management of severe aortic stenosis. They went on to opine that this paradigm shift is anticipated to yield improved patient outcomes, public health, and resource utilization. They say the time has come for aortic valve replacement for asymptomatic severe aortic stenosis. Their recommendation is stage C1 patients should be recommended. What is stage C1? Normal aortic valve area is around 3 to 4 centimeters squared. When it's tight, when the valve area is less than 1 centimeter squared, the peak velocity is greater than 4 meters per second, and the gradient is equal to greater than 40 millimeters of mercury, and is a preserved ejection fraction, left ventricular ejection fraction. Remember 4, peak velocity more than 4 millimeters per second, and gradient is greater than 40 millimeters of mercury. A randomized trial called EASY-AS acronym plans to recruit 2,844 patients with severe aortic stenosis. This trial will establish whether a strategy of early aortic valve replacement in asymptomatic patients with severe aortic stenosis reduces cardiovascular mortality or heart failure hospitalization.